All right, what is osteoporosis?
A bone.
It's breakdown of bone caused by deficiency of estrogen, which is why we usually see osteoporosis when women go into menopause.
Right? Is that
What'd you say?
Yes.
the small, teeny, tiny
Asian women.
Yes, Asian and white.
Right?
Yes, Asian and white. All right, so in osteoporosis, there are lots of different drugs we can use to treat it, okay? But why would we just not give them estrogen if this was a deficiency of estrogen?
Because estrogen causes breast cancer.
It causes breast cancer, and we don't want to do that. Estrogen also clots. Remember that? Estrogen causes clots. Estrogen causes clots. All right. So these osteoporosis drugs are an absolute joke. Okay, so if anybody tries to put you on one, just say no. Okay, and you're about to see like how these are the absolute this is horrifying and so stupid. All right, so the first drug class is biphosphonates. These are one of the most testable drugs because they are horrible for you, so they're always tested on. Okay, like they have really bad adverse effects. These all end in dronate. They all end in dronate. We have alendronate, risedronate, risedronate, ibandronate, and they will market them as prevention and treatment of osteoporosis. So if you are a little white or Asian lady, they may say like, hey, you don't have osteoporosis now, but just jump on these drugs. And here's the thing. These drugs have a half-life of 10 years. Excuse me. How long does that last in your body?
40 years.
40 years. Ain't that something?
That's crazy.
Like, girl, no, I am not taking this. And hold on, it gets way worse. All right, so how do dronates work? Dronates work by suppressing your bone resorption. They decrease the number and activity of osteoclast. What do osteoclast do? They kill your bones. So it decreases those, helping you to build bone. Okay? These drugs are so acidic as they are sitting. And they're huge. If they get lodged, like while you're trying to swallow them, it will burn a hole through your esophagus. Esophageal erosion. So it obviously, like, heartburn is a big one, right? Because they're big and giant and acidic. Y'all with me so far?
Yes.
Okay. Because they have caused holes in people's esophagus, you'll see where I put this big star, and this is going to be on your, I can guarantee you, if you're getting tested on this, this is on your test. You're going to take it with a full glass of water first thing in the morning on an empty stomach, and then you have to sit like this with no food or drink for 30 to 60 minutes to make sure the sucker goes all the way down and you don't burn a hole in your esophagus. Okay?
The whole thing, too, was a test question for me.
Yes, they will do usually a select all that apply because this has to be given exactly like this, okay? Then not only that, but like the rest of your bones are fine, but it causes osteonecrosis of your jaw, dead jawbone that you have to get taken out. Your jaw, y'all. You don't look good without a jaw, okay? Yeah. Long term, it causes fractures. Excuse me, why are we on osteoporosis drugs? To prevent fractures. Yeah. But if you take it long term, which they will have you on it long term, it causes unusual fractures. Then it causes you to go into AFib. What's your biggest risk with AFib? Yeah, y'all, give me my bad bones, okay? I will take the bad bones. I'm not going to have no jaw, a hole in my esophagus, okay? Like, it's just, it's a no. It causes them, when they first start to take it, they say it feels like a Mack truck hit you. Like, you get massive, look right here, flu-like symptoms, bone, joint, muscle aches, fever, flu-like symptoms, and ocular inflammation, so your eyes get, like, bright red and very painful. Sorry, this is awkward. Okay? So we understand to take first thing in the morning on an empty stomach, full glass of water, sitting up like this for 30 to 60 minutes, nothing else, and then you just have to sit like this. Okay? We do have to watch an EKG because, you know, if you go into AFib, I probably need to know that. Yeah. You have to be very careful when you go get dental work and let the dentist know, because as they start working on your teeth, you can get osteonecrosis of the jaw, and then they got to take out the jaw, and gross. Yeah. Report vision changes. Y'all know that's always, in nursing school, that's always a thing. Report all your vision changes. Okay. Do we understand your crappy dronates that last 40 years in your body and wear out everything? It's stupid. All right. The next one is raloxifene. It is a SERM. We have had SERMs before. What are SERMs?
Selective estrogen receptor modulators. Very
good. Selective estrogen receptor modulators. And that's because we want to give a patient estrogen, but I don't want to cause titty cancer. Sure. Yes? So we want it to mimic estrogen in certain places and not in other places. Yes. So what does estrogen do? What's your keyword? It's a tissue plumper and also estrogen clots. Okay. So it mimics estrogen in the bone. Remember, estrogen builds bone. It mimics estrogen in lipids. What was one of the clouds we did for estrogen? Do you remember when we did hormones? Yes. It regulates your cholesterol, right? So it will mimic it in lipids and it will mimic it in clots. So what does that mean for this drug? If it mimics estrogen, you can clot. You can clot. Okay. It blocks estrogen in the breast so you don't get booby cancer, and in the endometrium so you don't get uterine cancer. Okay. So it's preventing cancer, but it's going to mimic estrogen everywhere else. Okay. So if it's mimicking estrogen in the bone, what's it going to do to your bone? It's going to build bone. If it's mimicking estrogen in your lipids, it can cause high cholesterol. Yeah. If it mimics estrogen and clotting, estrogen clots. Okay. So the side effects look like hot flashes and leg cramps. Those look like menopausal-like symptoms because it is blocking estrogen in boobies and endometrium. Okay. It has a first pass effect. We're going to go back to first session. What is a first pass effect?
The first time it passes through the liver and then gets metabolized.
Yes, very good. The first time it passes through the liver, it metabolizes to almost nothing. So they have to increase the PO dose, okay? Because it goes through the liver twice. Very good, very good. Oh, very happy with you. It is also albumin bound. Albumin likes ass, and so it is acidic drug. It is attracted to it, which means if the patient has low albumin, they're gonna go toxic. I really don't want them going toxic on this because what's gonna happen to them? They're gonna clot. Yeah. So, biggest adverse effects of raloxifene, and by the way, we only give it in postmenopausal women, obviously because it's a SERM, okay? It can cause thromboembolism. What's a thromboembolism? A blood clot. Could be anywhere, right? Because a thromboembolism, what is an embolism? Sorry, let's go there.
A clot?
Well, hold on. What's a thrombus? A thrombus is a clot. An embolism is a traveling clot. And where does it travel? Well, you can get a DVT, okay? Or you can get a PE. Okay. It has a black box warning. What do we say a black box warning was?
Death.
Right? It can cause death by stroke because it can clot and cause a stroke. I'm sorry. This is stupid. Like, give me weak bones. You know what I mean? Okay. Yeah. So you need to have the patient report unilateral calf pain. What do they have? DVT. You need to have them report shortness of breath and chest pain. What do they have? PE. You need to have them report a severe headache. Stroke. Monitor their albumin levels. We can have them take calcium and vitamin D just for good bone health, you know. And remember, for osteoporosis, it's weight-bearing activity, right? We want to increase weight bearing. Build that bone, okay? Do not give it to lactating or pregnant women because it is a SERM and it will block estrogen in the breast, and we don't want that, right? They have marketed this drug, raloxifene, as helping to prevent breast cancer in women at risk.
Government sketchy.
They just want to kill us.
They want people on this drug. Do not give if they have a history of thrombotic events. So if they've ever had a clot before, I am not giving you raloxifene. You with?
Yes.
All right. Next one. We talked about it in the cheat sheet, but I'm going to go, calcitonin. What does it do? Tones down calcium, but in this case, we're using it to treat osteoporosis. It, again, is for postmenopausal treatment only. It comes intranasal. Remember, it comes as a nose spray. You can also give it IM or sub-Q. It is a synthetic hormone, okay? And it is a calcitonin receptor agonist. What's an agonist?
It
promotes, okay? So it's going to prevent bone breakdown, and it increases the bone density, so it makes the bone more dense, right? All right, biggest side effects. Rhinorrhea. What's rhinorrhea? Runny nose. Yeah, who cares? Headache, epistaxis. That's because you're giving it as a nose spray. That's the only reason why you're getting those. Rhinorrhea, headache, epistaxis. Okay. Yeah. Sometimes they can get anorexia, nausea, vomit. Like, they can feel kind of sick. You're giving yourself a huge amount of hormone. You know, if you give a lot of hormones, you feel kind of like you do Plan B. Yeah. You get sick. Okay. Okay. We don't need to know. All right. Calcitonin, remember, causes flushing. I told y'all that before. Yes. Okay. But remember, I think I've told y'all this before too. Anytime you give your body something that is a synthetic, something that it naturally produces, it doesn't like it. Mm-hmm. Right. So a lot of people can be allergic to it. Okay. It can cause hypocalcemia because calcitonin does tone down calcium. So watch their calcium levels and then watch for allergic reactions. Okay? Yep. All right, next drug is called teriparatide. Teriparatide. That one's kind of fun to say. Teriparatide. It is given sub-Q. Okay? It is a parathyroid hormone analog. Where is the parathyroid located?
Behind the thyroid.
Behind the thyroid. What is the job of the parathyroid?
Phosphorus.
Balances calcium and phosphorus. Okay. And what does parathyroid hormone do? It goes into the bone, grabs the calcium, and puts it into the blood. Okay. But parathyroid hormone also increases your osteoblasts. What do osteoblasts do? They build bone. That's why we're using it for osteoporosis. Yes. So they may still have a little nausea, a little headache, whatever. It can cause back pain. Any of these drugs may cause back pain because it's trying to build your bone and your back will hurt. Okay. No big deal. Just causes bone cancer. y'all. I don't know. It can cause hypercalcemia because its parathyroid is pulling calcium out of the bone and putting it into the blood. So you're going to teach them how to give it sub-Q, and then they need to report bone pain because it could be that you gave them
Too much?
cancer. No, you just gave them cancer. Okay. They do need to report any fractures because a lot of times bone cancer presents as a pathological fracture. Okay. Or any signs and symptoms of hypercalcemia. What are the signs of hypercalcemia?
Neuro. Is it neuro?
That's sodium.
No, it's muscle.
Muscle. Fatigue, lethargy, constipation. Remember, in hypercalcemia, all of your muscle stuff is... Okay. All right, last one on this sheet is denosumab. What did I tell you about anything that ends in mab?
It's infection.
Infection. Beautiful. Mab or sept is infection. Mab or sept. This one is a monoclonal antibody. The way that we are using it this time is because it decreases osteocalcemia class, which kill the bone. Okay. So of course it's going to cause joint pain, muscle pain. Okay. And remember I told y'all anytime something ends in mab or sept, they're at high risk of infection. So you need to report any signs of infection immediately. It causes, no big deal, just osteonecrosis of the jaw again and atypical fractures. Y'all, please make this make sense because the reason we're treating osteoporosis is to prevent fractures. So it doesn't freaking make any sense. Okay. It can also cause hypocalcemia. What are your signs and symptoms of hypocalcemia?
Fracture?
No, hypocalcemia.
Hypo. That's a good question.
I know. Ooh, y'all need to freshen up on
I
fluid and
know.
electrolytes. Spasms, tetany, twitches. Okay, so y'all remember calcium in and of itself is lazy.
Is it
All right,
checks
calcium
and
is lazy.
trousers? What is
So
that
if you-
one?
She 12 sticks.
Yes.
And she's talking about
Calcium is lazy. All right. So if you have hypercalcemia, you are super lazy. So all of your stuff is going to be like this. Calcium is lazy. So if it's hypocalcemia, you are less lazy. So all of the muscles are spasms, tetany, tight, chavosics, and trussos. Okay. Do not start a MAB if you have any signs of infection because you will die of an infection, but your bones will look spot on.
I'm gonna be looking good
Got
in
it?
my coffin.
Questions on this?